This video is about peripheral circulation, which is the circulation down to the feet. Circulation problems are potentially the most damaging to the foot. Let's face it, without proper blood flow to the foot, the tissues of the foot will suffer, and in some cases die, which is known as gangrene. Unfortunately, as we age, our circulation to our feet does become impaired. The degree of impairment will vary from person to person with factors such as genetics, lifestyle issues, including smoking, a poor diet, lack of exercise, and disease states like diabetes and high blood pressure, all of which contribute to a decreased blood flow to and from the foot. When a doctor examines the foot in regards to peripheral circulation, we look for the following: the ability to feel pulses and the strength of these pulses. We check the color and texture of the skin. Very pale or very red skin may be a sign of inadequate circulation. Thin skin may also be a result of poor circulation. Additionally, we observe hair distribution, as loss of hair can be a signal that circulation has diminished. Other signs of diminished circulation include conditions such as rashes, ulcers, edema, temperature differences between both feet. In general, one cold foot is suggestive of poor circulation, whereas two cold feet may also be indicative of anxiety, a neurological condition, or just a cold environment. Patients will come to us and mention recent changes that they have noticed which may suggest reduced blood flow to their feet. For example, if a patient complains of rest pain, meaning that their feet and legs will hurt at night, but find that when they put their feet in a dependent position or even standing, the pain subsides, that is highly suggestive of circulatory problems. There are those people who complain of walking a few blocks and experiencing calf pain. Finding that if they stop and rest, the pain goes away, only to return when they walk about the same distance, that too is highly suggestive of circulatory problems. That condition is known as intermittent claudication. Those who complain of the color of the feet when in a dependent position compared to when the feet are elevated may also be suggestive of a circulation issue. Sores on the feet that do not heal in a normal period of time may also be an indicator of circulatory problems. So, what exactly is atherosclerosis? The most common cause of poor blood flow into the foot is atherosclerosis or hardening of the arteries. This is a progressive degenerative process characterized by the deposition of fatty substances inside the wall of the artery along with fibrous thickening of the artery wall, resulting in diminished ability of blood to flow down to the foot. This condition in most people will go unnoticed and undiagnosed until the condition becomes symptomatic. When the initial symptoms of intermittent claudication presents itself, there is already significant disease present. What is essentially happening? Due to blockages in the blood flow to the feet, there is a mismatch between the oxygen supply being supplied to the feet and the metabolic demands of the muscles of the feet and lower legs upon walking. Simply stated, when muscles are working, they need fresh oxygen to supply them. Any reduction in this oxygen supply to a muscle will cause pain, known as claudication. This condition occurs predominantly among men between the ages of 50 and 70 years and usually starts after age 60. In women, it usually starts around age 60. Race and ethnic background also play a role, as African Americans have a higher incidence of peripheral arterial disease than non-African Americans. Studies have also shown that Hispanics present with more advanced lower extremity vascular disease and have worse outcomes, which includes a higher amputation rate after revascularization than non-Hispanic whites. An estimated 8 to 12 million Americans have atherosclerosis. Additionally, 50% of people with peripheral arterial disease are asymptomatic and usually go undiagnosed. The major causes of atherosclerosis include 1. Diabetes, which affects both the major blood vessels bringing blood into the foot and the smaller vessels which actually supply specific areas of the foot. Hypertension or high blood pressure is the second cause. This damages the arteries of the foot and leg over time. It is also worth mentioning that some antihypertensive medications will also adversely affect the feet in that they cause swelling and discoloration of the toleration of the extremities. Lastly, smoking, which may be the worst cause of damage to the arteries. Smoke from tobacco directly damages the inside of the arteries. So what treatments are available for atherosclerosis? There are a few different treatments for this condition in the lower extremity, and treatment is based on a number of factors including the degree of blockage either by occlusion, which is plaque, or by stenosis, which is the narrowing of the artery. Additionally, the age of the patient and their general overall health is a consideration. Believe it or not, walking is considered the primary treatment in treating arterial sclerosis in mild to moderate cases. In fact, walking works better than oral medication. However, we are talking about a daily walking program on a graded treadmill for 30 minutes. Initially, 30 minutes per day may be impossible for many, so you need to work up to that number. This should be a supervised program and you should have clearance from your doctor. The reason this exercise needs to be monitored is that if you have blocked arteries in your legs and feet, it can be assumed that you have blocked arteries elsewhere in your body, including your heart. Exercise on a regimented physician-supervised program can reduce the symptoms of intermittent claudication in as little as 6 months in many individuals. The problem here is that many people would rather pop a pill daily than to go out and get some exercise, but statistically it has been shown that walking is far superior to medication in this situation. Medications that are used for peripheral arterial disease include cilostazol, which increases blood flow by dilating or opening up the arteries. Pentoxifylline is another drug, which works by making red blood cells more pliable so that they can squeeze through narrow arteries. In more severe cases of atherosclerosis where conservative measures have failed, surgical bypass of the blocked artery is the only treatment available. This is accomplished through the use of stents to open the clogged artery and bypass surgery where the circulation bypasses the blocked artery. In situations where circulation cannot be restored to adequate levels, the tissues in the feet die. This is known as gangrene. The only option here is amputation of the gangrenous parts to a level where there is still adequate circulation. If the amputation is not done high enough up, gangrene may once again set into the remaining tissue.